Three, two, one. Hello, and welcome to our Next Generation Neuropathy Care webinar. I'm Dr. Joe Doduro. I'm joined by Dr. Dwayne Thomas. And we're going to explain to you today the Jumpstart Accelerated Neuropathy Program. For you that don't know anything about me, I'm the president and founder of the Neuropathy Treatment Centers of America, a nonprofit that brings researchers and patients together to talk about the new breakthroughs in neuropathy care. I'm also the past president of the Concentral Laboratories and the ProNeuro Light, and I'm going to have Dr. Thomas introduce himself. So you that don't know him, hi, Dr. Thomas.
Hi, Dr. Doduro. My name is Dr. Dwayne Thomas. I'm a chiropractor in practice for 30 years, the last 5 of which have been exclusively treating neuropathy patients in office and teaching doctors around the country how to treat neuropathy. And really, lately, it's been more teaching doctors how to get the most out of their neuropathy care by putting this neuropathy care into patients' homes. I have worked for some very large neuropathy practices, sold upwards of $10 million worth of neuropathy care over the last 5 years. So it's been really my passion for the last 5 years.
And I think that you'll see as you go forward that he's bringing in some very new ideas to this. So this is the next generation neuropathy care. It's not your brother's neuropathy practice. It's not the way you or even I always did it. It's not the same style or form of practice. Not the same results. It's not the same patient outcomes, and it's not the same profits. Right? This is a totally and completely different practice model. So let me walk you through that, and Dr. Thomas and I will walk you through how this goes. I want you may be sitting in your car or home or office in Pensacola or, Pisco Beach or something, but I want you to, if you're not driving, close your eyes and let's do a little mind experiment that we're going to take your practice, we're going to pick it up, all your office staff and everything, we're going to take them up and put them in a different city. In a different city might you always want to go to. Maybe one that has a beach. The air is going to be different. The place is going to be different. It's totally different. Your office is going to look different. Your waiting room is going to be different because the people are going to be different there. Maybe they're going to speak a different language. Maybe you're going to have to learn to relate to them. But here in this area, it's okay to do things differently, right? Because they're not used to the same old way that you did it. Because how are you doing neuropathy in your office right now, right? Let's take a thing. Doc, when you were selling people to do the in-office care and you sold millions and millions of dollars, what was your best month of selling?
My best month.
What did you close? What was your numbers that you did your best month of in-office sales?
Just over $300,000.
Yeah, and some doctors will make that in 5 years, and you did that in a month.
Correct.
So if you're doing treatments Monday, Wednesday, and Friday, and you're trying to get accumulation of the care, it's not really going to benefit that much, right? Than if you did it every day, right?
Well, it's definitely
no. If they're going here, they're only going to get to Wednesday, really, right?
Correct. It's actually a lot more treatment if you're doing it at home daily rather than doing it in the office 3 times a week.
So the light bulb should go off in people's heads. Wait a minute. I'm only getting to Wednesday 3 times accumulation, then I start again. But if I'm going all the way to Sunday, I'm doing better. It's the same thing if you were giving people oxygen. Would you want to give them like 30% of the valve or give it every other day if this is their acute stage? No, you'd want to give it every day. And the more, if they can handle more, a higher dose eats better results, right? Not talking about this type of oxygen, big bulky units. We're talking about this type of oxygen, small in-home units to help people function better. As another example, what about these CPAP machines? Why do they put those on? Because you need oxygen all the time, even at night. Right, Doc?
Absolutely.
Right? And if this fat guy needs a CPAP machine to breathe at night Don't you think he needs a neuropathy machine at home to walk once he wakes up in the morning?
I would certainly think so.
So I want you to kind of think about in your new towns, then they do things differently, and you want to have maximized results. You want to think of yourself as maybe like an optician. You come in, they do the exam, you give them their prescription, and away they go. But we're a little bit different because we're selling glasses where it can also sell therapy. It's a hybrid. It's different. It's the next generation. We want you to update your current neuropathy practice, being more efficient, less stressful, more profitable practice, better results, more satisfaction. Lower your overhead. How would you do that, Doc? How would you describe this program's going to be able to be less stressful and more profitable?
Well, the real beauty of the program is that you still have all the diagnostic tools available to you. You bring the patient in for their initial diagnostics, the report of findings, you sell them on the program, but the treatment is done by the patient at home with your guidance. So you don't have all this, you don't have to dedicate more and more square footage. You don't have to have all the equipment in your office. You don't have to have all that extra staff time. Reminder appointment calls, all those things that are just adding stress to the practice.
And it adds money. So really, if you really want to be in your practice all the time, you know, and spend money on to pay $15 an hour for everybody to come in and be worried that somebody's not going to show up, don't do this. But this is how we do it. Now we're going to show you. This is our Jumpstart Accelerated Neuropathy Program. You may want this, and you may want to figure out how to do it.
You're also expanding your circle of influence because you can get people from farther and farther away that you can actually give beneficial treatment to that maybe you were missing before, or they were saying they're not going to come to your practice because you're too far away, or they have mobility issues that prevent them from coming to the office on a regular basis.
Right? Why should they drive if they can't feel their feet? You're doing a disservice. You might get sued because you told them to come to your office. But this is how we do it, and we call it the Jumpstart Accelerated Program. You may want this. Here's how you do it. We're going to take a little bit of our juice and jumpstart your practice with it. Huh? Right? We got a full battery. We know how to do this. We've been doing it for years. We're going to give you all the forms needed. We have subjective screens. We have severity. We have client evaluations. Many different kinds to fit your expertise, right? We have brochures. We have the financial sheet that explains the program to them. We have our report of findings, all set for you. Home therapy instruction guide, the personal treatment protocol, our manuals, right? Our nutritional guidebooks, that's important for their follow-up care. And here's the pitch, okay? We're going to sell you lights for $840. A set of lights to go home. The finest lights that we can find. You're going to turn around and sell it for $4,200 or more.
The program.
For your in hybrid program. And that's a pretty good knuckle right there, right, Doc? $4,200, but that's a 500% markup for you.
Absolutely.
And $3,360 of added profit. So you don't have to give that to your staff.
Well, the beauty of this
goes to
is, like we said, you're cutting down on your overhead. You're cutting down on your stress in the office. All these things are more, the patient's happier, and we're getting better results. We are getting better results by having this therapy done in the home rather than having to come to the office.
Yeah, I was good after the therapy, and then it starts hurting again. I don't think this is working. Of course not. Turn the jets on. Give them the full dose of what they need. And these are the stuff that we're using. State-of-the-art, in-light neural pads. They're the finest things out there. And these are the two systems that you can pay for. You can do the two-port POTI system or the pain system. And make a run for it, right? These are type 2 medical devices, the FDA cleared. We don't want any cheap Chinese stuff in our offices. You don't want any non-FDA stuff so that you get in trouble with the government.
I might point out too, that anybody who has sold in the past HealthLight or Pro Neurolight, these are the exact same quality. These are the exact same lights.
Yep, made in America for 33 years. And you know that they're going to last, right? They're built to last 10 years. And the guys that are hearing this, that are doing neuropathy, they know that those things still stay there, right? These are the pads that you can use.
10 years of clinical usage. So when they're being used at home, they're not being used like they are in the offices. So they're going to last even longer.
I believe that's correct, Doc. And we're going to show you everything that you need to go. Reality. Could it be as simple as this?
Absolutely.
I think so. Here's how it works. Go ahead, Doc.
So I want to just point out that we have programs. We have a self-guided program. We have marketing programs. We have on-site training programs. So I just want to point out that our Jumpstart program is a way for people who want to kind of bypass all the self-learning and that sort of thing and get up to speed really quick. That's why we're offering this Jumpstart program. So it's just a very quick way of getting going, and it includes all of our marketing pieces and our forms packages, which would be add-ons to our other programs. But let's just go through this.
Right.
So
so we're gonna give you the.
It would be an exclusive video training on the process of identifying, examining, and diagnosing qualified neuropathy patients. Number 2 would be the basic information on which marketing methods best attract qualified neuropathy patients to your office. Now, these are tried and true. We've been using them for Dr. Duro's been using them for at least 15 years. I've been using a lot of these same marketing pieces for the last 5 years, and they're just tried and true pieces that definitely will attract patients to your office. We're going to give you an ROF training video on the report of findings and best practices for high-level neuropathy selling. We're going to give you the forms package, which is a turnkey forms package for the exam, the sales, and treatment programs, which normally is a $2,000 value. We don't charge $2,000 for this package. It's included in the Jumpstart program. A couple bonuses. Bonus number 1 would be discounts on low-cost marketing pieces that you can use to attract new patients and jumpstart your neuropathy practice without spending a fortune on marketing. Get going right away. Get these things out there. Get these patients coming in right away.
That's a bonus.
Bonus number 2. We give you a 1-hour free video conference call to answer any questions on how to use the forms package and proper implementation of these forms.
I would like to add that when we do this video conference here, or at least phone call thing, I'm going to tell you how to, boost up the people that you get your neuropathy practice going just from people you have in your office right now. Tried and true.
Good point. And bonus number 3, Dr. Duro has put together an extensive library over the years, probably consisting of maybe 200 different aspects of neuropathy care. And so the first staff member that you wanted to put into that library so they could learn all about neuropathy as well, we would give you a discount on that program as well.
That's great. Now this is the complete kind of university where you're going to learn, if you wanted to, you're going to be able to learn when you're doing the self-taught program, if you wanted to, the liability, legal and compliance issues of doing neuropathy care. What does light therapy do? What is neuropathy? These are the processes and the programs that we have built to teach you, but that's going to come later because we just want you to jump start and go for the money, man. Go for the money. So that's the program, and here's the package, $36.50. Sell 1 patient, a set of lights in the next 2 years, and you paid for the program. Pretty amazing. All you have to do is call a number. Dr. Dwayne is around. He's here to walk you through it, right? It all comes to you bang instantly. All you have to do is say yes, and you'll get all this stuff. You can download it in 5 seconds, or I'll send it to you on a stick drive. But we know what to do to jumpstart your neuropathy practice or revitalize what you have there. 38360, and there's the number. Doc?
Well, I think that one thing that I would want to leave people with is that we're all kind of resistant to change in our lives. And sometimes we get stuck into these ruts of doing things the same old way. But really, this is the way that neuropathy treatment should be provided now. It's going to be a lot less stress on you, and it's going to be a lot more effective for your patients, and you're going to have a lot happier patients.
Makes sense to me. I will look forward to hearing from you and helping you get this done. Thanks a bunch for your attention. Hope to see you on the net.